How well are you monitoring your immunization program? To determine how well you are monitoring your immunization program, you must consider three things. First, the accuracy of the numbers being reported. If you were to look closely at the reported data, would the numbers be correct? Second, the timeliness and completeness of reported data. And third, the overall quality of the monitoring system. In other words, are the right things being measured? Are they being measured and analyzed in the right way? To do this type of evaluation, staff at the regional or national level may decide to use the Data Quality Self-Assessment Tool, or DQS. The tool helps you ask the right questions at the district and health facility level in order to determine the accuracy and quality of your monitoring. In this video, we will show you the basic components of a DQS. The process of conducting a DQS is usually different from country to country, but we will introduce you to the types of questions asked in a DQS. Once you have done a self-assessment, you can determine where your strengths and weaknesses are. This is the whole point of doing a self-assessment, to determine what you can do at the district or health facility level to improve the way you capture data and to make sure your data is of good quality. Because ultimately, without good quality data on immunization coverage, you really have no way of knowing whether your immunization program is performing to its fullest potential. Data of good quality is essential to running an effective immunization program. The first questions asked in a DQS are about accuracy. How accurate are the immunization coverage data? Usually, staff will look at monitoring practices at the district and/or health facility level. So when trying to answer this question, staff will typically examine data collected at the point where vaccines are given, such as tally sheets, or at the data compiled at the health facility or district level, or all of these. Staff will choose a particular vaccine dose, such as pentavalent 1, and a particular time period, such as the previous year. Then, they will gather all the records relevant to the vaccine dose and the time period, such as immunization records, tally sheets, and monitoring charts. They may even interview a sample of children or mothers if staff suspects over-reporting or under-reporting in the registers. Once staff has gathered all the data, they can recount the number of vaccinations given and compare it with the numbers reported. After doing this for several randomly selected health facilities or districts, staff may start to see patterns of error. The second group of questions asked in a DQS are about this. How timely and complete is the data being reported? Were monthly reports sent in by all health facilities by the due date? If not, does the district have a procedure for monitoring and dealing with late reports? The third and biggest group of questions in a DQS focuses on overall quality. How good is each component of your monitoring system? In other words, are all the monitoring components in place and functioning? Or are you skipping certain practices? Does everyone know how to use the monitoring systems in place? Are you using the data that you have collected to make improvements? This step involves answering a lot of questions about which components are in place and how well they are working. For example, during this step, supervisors may observe an immunization session to see whether vaccinators are filling out immunization cards, the immunization register, and tally sheets properly. Or, supervisors may look at stock records to see whether a health facility has calculated wastage rates correctly. At the district level, regional supervisors may check that a district map and immunization coverage charts are on display and that they list all communities. After doing the work of a DQS, all staff should be able to see the results. Use the results to pinpoint the 2 to 3 issues that are most urgent and that need the most focus. These 2 or 3 priorities, as well as corrective actions, should be integrated into annual plans of action and should be reviewed during future supervisory visits. By diagnosing problems with the Data Quality Self-Assessment tool, you can find out what your immunization program needs in order to provide quality information that will help you reach every child and pregnant woman.